Welcome to another episode from the Veterinary Medicine Digest. The story we are about to tell is one of hope, high-stakes science, and a relentless pursuit of a cure for a disease that has haunted dog owners for over half a century. It is a story that begins not in a laboratory, but in the gate of an aging German shepherd in 1973. At that time, a researcher named Avril described an insidious and progressive condition. He saw dogs that were once vibrant and strong begin to stumble, their pelvic limbs losing coordination in a slow-motion collapse that eventually led to total paralysis. For decades, this condition was known simply as Canine Degenerative Myelopathy, a name that essentially admitted our ignorance, as it described a non-specific wasting away of the spinal cord with no known cause. For the owners of these dogs, the diagnosis was a death sentence. There was no treatment, no way to halt the march of the disease as it moved from a slight wobble to a complete inability to walk, usually within 6 to 9 months for the larger breeds. As the paralysis ascended the spinal cord, it eventually reached the thoracic limbs, and, if euthanasia was delayed, it would take the dog's ability to bark, to swallow, and finally, to breathe. For years, veterinarians and researchers were essentially looking at a black box, a mystery of the central nervous system that seemed to target specific breeds like the German Shepherd, the Pembroke Welsh Corgi, and the Boxer. But the mystery began to unravel in 2009. A team of researchers performed a genome-wide association mapping and identified a critical link that changed everything. They found that this devastating disease was associated with a mutation in a gene called superoxide dismutase 1. This was a massive breakthrough because superoxide dismutase 1 was already famous in the world of human medicine. It was the first gene ever linked to amyotrophic lateral sclerosis, the fatal paralytic condition often referred to as Lou Gehrig's disease. Suddenly, canine degenerative myelopathy was no longer just a veterinary curiosity, it was a spontaneously occurring mirror of a human tragedy. The specific mutation in dogs was a transition from guanine to adenine in the second exon of the gene, which predicted a change from glutamic acid to lysine at position 40 of the protein. This was a toxic gain of function mutation. The protein itself, which normally acts as a crucial antioxidant to scavenge free radicals, was instead misfolding and clumping together. These aggregates were found within the neurons and the supporting glial cells of the spinal cord, acting like microscopic grit in the machinery of the nervous system. As we dive deeper into the pathology, we see that the destruction is not limited to the neurons themselves. Recent research has turned our attention to the supporting cast of the central nervous system, specifically the glia. Oligodendrocytes, which are responsible for producing the protective myelin sheaths around axons, seem to be failing. They are not just losing their ability to insulate the nerves, but they are also failing to provide the essential energy metabolites that axons need to survive over long distances. Researchers found a prominent reduction in monocarboxylate transporters 1 and 2, which are the biological shuttles for energy substrates like lactate. At the same time, they saw an increase in monocarboxylate transporter 4 within activated astrocytes, which are the reactive cells that rush to the site of damage, often contributing to a cycle of neuroinflammation. This microscopic war zone leads to a phenomenon described as a central and peripheral axonopathy. The long axons that carry signals from the brain to the muscles and back again begin to waste away. Some researchers hypothesized this was a dying back disease, where the part of the nerve furthest from the cell body is the first to perish. While this theory fits some parts of the disease, the pathology of canine degenerative myelopathy is uniquely complex, involving both upper and lower motor neurons and even sensory pathways. In fact, significant loss of sensory root axons and the death of sensory neurons in the dorsal root ganglia have been found to precede the actual physical loss of the motor neurons themselves in some stages of the disease. For years, the diagnostic approach was one of exclusion. If an older dog had the characteristic stumbling gait, but no signs of a slipped disc or a tumour on a magnetic resonance imaging scan, it was presumptively diagnosed with degenerative myelopathy. But this was far from perfect. Older dogs often have multiple things going wrong at once, like arthritis or spinal stenosis, which can mask or mimic the disease. This led researchers on a quest for a reliable biomarker, something they could measure in the blood or the spinal fluid. One promising candidate emerged: phosphorylated neurofilament heavy. This is a structural protein that is released into the cerebrospinal fluid when large, myelinated axons are damaged. Studies showed that dogs with degenerative myelopathy had significantly elevated levels of this protein in their spinal fluid compared to healthy dogs or even dogs with other types of spinal cord disease. Despite these advances in understanding the disease and diagnosing it, treatment remained frustratingly elusive. Owners were left with few options beyond intense physical therapy, which was shown in one study to extend survival time but could not stop the eventual progression. Corticosteroids, vitamins, and various supplements were tried, but none were able to truly change the course of the disease. The root of the problem was the mutated superoxide dismutase 1 protein itself, and the only way to truly stop the damage was to stop the production of that protein at the source. This brings us to the heart of today's deep dive: the development and pilot testing of a revolutionary new approach called U1 adapter therapy. This work, led by researchers like Natasha Olby and Samuel Gunderson, represents the first time this specific type of gene silencing technology has been tested in a large animal with a naturally occurring disease. To understand how it works, we have to look at the very way cells create proteins. Most gene silencing techniques, like small interfering ribonucleic acids or antisense oligonucleotides, work by finding and destroying the messenger ribonucleic acid after it has been fully formed or by recruiting enzymes to chew it up. The U1 adapter technology is different. It targets a fundamental step in the life of a messenger ribonucleic acid transcript, the addition of the polyadenine tail. Almost every transcript in our cells needs this tail to be stable and to be translated into a protein. The U1 adapters are single-stranded oligonucleotides that essentially tether a specific splicing factor, the U1 small nuclear ribonucleoprotein complex, to the end of the target transcript. By doing this, they prevent the tail from being added, which causes the transcript to be rapidly degraded by the cell. It is a surgical strike at the genetic level, designed to be less toxic and easier to deliver than previous methods. The researchers divided their pilot study into 2 phases. Phase 1 was about establishing the rules of engagement. They used 7 purpose-bred healthy adult dogs and 1 mixed-breed dog that was already in the late stages of degenerative myelopathy, specifically stage 3, which meant he was already unable to walk and had weakness in his front legs. Their goal was to see if they could safely deliver the therapy into the spinal fluid and if it would actually lower the levels of the mutated superoxide dismutase 1. They started with a dosage of 1.5 milligrams per kilogram, a number they extrapolated from prior successful studies in mice. The delivery was done through an intrathecal injection, meaning it was placed directly into the subarachnoid space around the spinal cord. In the first 2 dogs, they tried using a thin catheter, but they found that in these smaller beagles, the catheter itself caused some mild trauma to the delicate nerve fibers. They quickly adapted, switching to a direct injection with a spinal needle, which the dogs tolerated much better. The results from phase 1 were encouraging. When they looked at the spinal cord tissue 5 days after a single injection, they saw that the levels of superoxide dismutase 1 messenger ribonucleic acid had been reduced to a median of 37% of what is normal near the site of the injection. This was exactly what they were looking for, a knockdown of greater than 50%. The dogs recovered from the anesthesia without any clinical or histopathological adverse effects. They even pushed the dose to 3 milligrams per kilogram in 1 dog and found that the silencing effect lasted for at least 30 days. But the true test was phase 2. In this phase, they recruited 4 companion dogs that had been diagnosed with early-stage degenerative myelopathy. These were beloved pets whose owners were willing to participate in a trial that required monthly trips to the hospital for general anesthesia and spinal injections. These owners were the pioneers, hoping to save their own dogs while knowing they were contributing to a future where this disease might finally be conquered. The protocol for these dogs was intense. Before every treatment, they underwent physical and neurological examinations, with their gait and reflexes carefully recorded on video. Their blood and urine were tested, and a sample of their cerebrospinal fluid was taken to see if the therapeutic agent was still present from the month before. Once the dog was anesthetized, the U1 adapter was injected slowly over several minutes. After the needle was removed, the dogs were tilted head down at a 30-degree angle for 15 minutes. This was a critical part of the plan, an attempt to use gravity to help the medicine flow from the lower back up toward the neck and brain, where the disease also does its damage. As the study progressed, the researchers monitored these 4 dogs for months. 2 of the dogs were treated for a full 10 months. Throughout this time, they saw no clinically relevant changes in the dog's blood work or their spinal fluid. The procedure was safe. However, they did encounter a few hurdles. Twice out of 34 total injections, they had to abort the procedure because the pressure within the spinal canal became too high during the injection. In one case, the dog woke up from anesthesia with some twitching in his legs, but he was treated with a medication to reduce intracranial pressure and was back to normal within an hour. Despite the safety and the successful silencing of the gene, the clinical results were a sobering reminder of how difficult this disease is to treat. All 4 dogs in the second phase continued to decline. Their gait scores, which measure their ability to walk and support their own weight, steadily worsened according to the typical timeline for untreated dogs. The time it took for them to progress from the first signs of stumbling to a complete inability to walk was a median of 9.5 months, which is almost identical to the natural history of the disease. When the researchers looked at the tissues after the dogs had eventually passed away, they found the reason for this lack of clinical improvement. While the medicine was very effective at the site of the injection in the lower back, its concentration dropped off significantly as it moved up the spinal cord toward the neck. It was a gradient of distribution. In the cervical region, the silencing was inadequate. This was a crucial finding because, as we know, degenerative myelopathy is a whole system disease. If you only treat the lower back, the damage in the neck and the brain will continue to progress, eventually causing the dog to lose his front legs and his ability to breathe. This highlights one of the biggest challenges in treating neurological diseases: delivery. The central nervous system is protected by the blood-brain barrier, a tight seal of cells that keeps most medications out. Even when you bypass that barrier by injecting directly into the spinal fluid, the medicine doesn't always move through the system effectively. The cerebrospinal fluid has its own dynamics, and the larger size of a dog's brain and spinal cord compared to a mouse makes it much harder to achieve a uniform distribution. But the researchers are not deterred. They have already identified several ways to improve the next generation of this therapy. One idea is to conjugate the U1 adapters to specific peptides that can trick the blood-brain barrier into letting them through, which would allow for a simple, intravenous injection that could reach the entire central nervous system at once. Another option would be to use a catheter to deliver the medicine directly into the ventricles of the brain or the upper part of the neck. They also learned that timing is everything. In this pilot study, they recruited dogs that already had visible signs of the disease. But by the time a dog starts to stumble, a significant amount of damage has already been done to the nerves and the muscles. The consensus in both human and veterinary medicine is moving toward the idea that we need to intervene as early as possible, perhaps even before the first symptoms appear. With the availability of a commercial genetic test for the superoxide dismutase 1 mutation, we can identify at-risk dogs when they are still puppies. The implications of this work go far beyond the world of veterinary medicine. Because canine degenerative myelopathy is such a close model for human amyotrophic lateral sclerosis, every lesson learned in these dogs is a potential shortcut for human researchers. The failure of many human drugs to translate from mouse models to human patients is often blamed on the fact that mice are simply too different from us. Their nervous systems are simpler, their brains are smaller, and the ways we induce the disease in them are often artificial. Dogs, on the other hand, live in our environments, they age like we do, and they develop this disease spontaneously. This pilot study provided the foundational evidence that U1 adapter technology is safe and feasible in a large mammalian model. It showed that we can surgically silence a specific disease-causing gene within the spinal cord. While the first 4 dogs did not see a clinical cure, their contribution has paved the way for more refined delivery methods and earlier intervention strategies. It has brought us one step closer to a day when a diagnosis of degenerative myelopathy is no longer a death sentence, but a manageable condition. As we wrap up this deep dive, it is important to remember the scale of this effort. The mutated superoxide dismutase 1 allele has been detected in at least 91 different dog breeds. It is widespread and common in our pet population. For breeders, the challenge is to use genetic testing wisely, avoiding the production of homozygous at-risk puppies while also being careful not to narrow the gene pool so much that they accidentally select for other diseases. It is a delicate balance of science and stewardship. The journey from the first description of the disease in 1973 to this first test of a cutting-edge gene therapy in 2026 is a testament to the power of persistent research. It is a journey driven by the love people have for their dogs and the desire to see them live long, healthy lives. The researchers, the clinicians, the breeders, and especially the pet owners who participated in these trials are all part of a larger story of discovery. Thank you for listening. The titles for the reference papers are in the video description, from VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.